What is the menopause? Menopause is defined as a permanent cessation of menses in the absence of ovarian activity, which is depicted by an FSH, which is a follicle stimulating hormone value of more than 20. So, what is typically the age of menopause in women? After the age of 35, the ovarian activity slowly starts to decline, and we call this period the climacteric. So, here, because of ovarian deficiency, there could be a little bit of issues like hormonal imbalances or bleeding issues or other patterns. But typically, when it comes to nearing the menopause, women say that, Doc, I'm suffering from hot flashes. Oh, I have a low feeling, or I have a feeling of being depressed, or lowered self-esteem, or oh, the children don't really care for me now, or children are grown up, husband is not really interested, and they tend to get more into a recluse state. And this is something that happens typically due to estrogen deficiency. A third thing that women typically complain of is lack of sexual desire and pain during sexual intercourse, or lack of lubrication, giving rise to a very unsatisfied sexual act. Hi, I'm Dr. Ranjana Dhanu, and after 30 years of practice, clinical practice, I've decided to educate all my women viewers about different issues. And today, the request that I have is to handle or to explain how the menopause affects a woman. So, typically, what is the menopause? Menopause is defined as a permanent cessation of menses in the absence of ovarian activity, which is depicted by an FSH, which is a follicle stimulating hormone value of more than 20. Why do I say permanent cessation of menses? Because there are certain conditions wherein a woman does not get her periods, which could be pregnancy, it could be hormonal issues like prolactin excess or thyroid, or it could be certain injections or certain medications given to women, or certain chemotherapeutic agents given to a woman, which could cause a temporary cessation of menses. So when I say permanent cessation of menses, it means that these ovaries have stopped functioning. So normally these ovaries will start functioning around the 11th or 12th year up to the menopause. So what is typically the age of menopause in women? It could vary anywhere between 41 to 53 or 54 years, but today surprisingly we're seeing women even at the age of 55 or 56 having regular periods, and that's because of their healthy lifestyles. So what typically starts to happen to women with estrogen deficiency? Now, ovarian function does not decline suddenly. After the age of 35, the ovarian activity slowly starts to decline, and we call this period the climacteric. So here, because of ovarian deficiency, there could be a little bit of issues like hormonal imbalances or bleeding issues or other patterns. But typically, when it comes to nearing the menopause, women say that, Doc, I'm suffering from hot flashes. So a hot flash is typically a disturbance in the thermoregulatory mechanism in the brain. So what happens over there is, because of these spurts of estrogen or estrogen deficiency, a woman typically says that, Doc, I was so embarrassed because I was sitting in a meeting and suddenly I started to have this hot flash. So these flashes can be one or multiple, a sudden feeling of warmth or sweating, and that could be really, really embarrassing and very distressing. So that is one. The second thing is an imbalance between the endorphins and the enkephalins. We do know that endorphins are the feel-good hormones and enkephalins are the feel-low hormones. So normally estrogens maintain a balance and they keep the endorphins, which is a feel-good factor, high. But with estrogen deficiency, what starts to happen is the endorphins go down and the enkephalins go up. So typically women say that, oh, I have a low feeling, or I have a feeling of being depressed, or lowered self-esteem, or oh, the children don't really care for me now, or children are grown up, husband is not really interested, and they tend to get more into a recluse state. And this is something that happens typically due to estrogen deficiency. Crying spells, emotional outbursts is also another typical complaint that women complain of. Then we come down to certain physical effects that start to happen. So there could be flattening of the breast because there's maldistribution of fat. Women start to have centripetal obesity. So they start to put on more weight around the belly button or around the midriff. So I always tell patients that you should be exercising and keeping your midriff well. So it's either yoga or Pilates or something that you have to assume. Coming lower down in the pelvis, what starts to happen typically in women who've had normal births is because the uterus is only hung by ligaments, there is no bony cage, and due to estrogen deficiency and lack of collagen, this uterus starts to herniate down. So typically a woman will say that, doc, I feel that my uterus is sagging down, so I feel something coming down my vagina. This complaint was not so bad initially, but with my menses now disappearing, I'm seeing that my uterus is sagging down. One, or exacerbation of stress incontinence. So when women start to say that I'm leaking urine on coughing, sneezing and laughing, this particular complaint was not so severe, but now again due to lack of collagen and estrogen, this complaint becomes more pronounced. A third thing that women typically complain of is lack of sexual desire and pain during sexual intercourse, or lack of lubrication, giving rise to a very unsatisfied sexual act. So these are typically certain complaints, and also another complaint is recurrent urinary tract infection. So why does this happen is because the lining, which is the protective lining, the mucosal lining of the vagina and the bladder and the urethra, usually with estrogen, is nice and moist and thickened. But with the onset of menopause, because of thinning of these linings, there could be either a dry intercourse or there could be recurrent urinary tract infections, which could be debilitating for a woman. This is called typically the perimenopausal, the postmenopausal urogenital syndrome. After this, what are the delayed effects of the menopause or delayed effects of estrogen deficiency? So one which is hitting women big time today is Alzheimer's or dementia. It could be either osteoporosis. So we do know there are two things about a bone. There is a joint and there is an entire bone. So the joint getting aged is because of lack of the synovial fluid. So it could be arthritis, it could be infective, or it could be old age arthritis, which is osteoarthritis. But when this particular bone starts to get weak, because this bone is formed by certain lamellae which keeps the bone strong. So with estrogen deficiency, there is a catabolic effect where these bones tend to get brittle. So it's typically like you drop a coral on the floor and it breaks. So typically women start to have lowered bone mass, and we typically hear that somebody's aunt or somebody's grandmother fell into the bathroom and fractured her thigh bone, which can be a very lethal complaint. So that is one of the osteoporosis, and osteopenia can really hit women big time. And the last complaint is cardiovascular disease, which also could happen due to estrogen deficiency. How do we tackle estrogen deficiency and the menopause? So I have a little story for you here. What happened in the 50s and 60s is when HRT, hormone replacement therapy in the form of conventional estrogens, was introduced, there was a huge rush amongst all the cosmetically aware women in the US and the UK and the Western countries saying, oh, I want the elixir of youth, I want estrogens, and they all started to take estrogens to remain youthful. What started to happen is after 5 years, they started to see that there was a very high incidence of breast disease in the form of breast cancer and uterine body cancer or endometrial carcinoma. So then there was a WHI initiative, which was a World Health Initiative, which decided that only symptomatic women should be treated for the menopause, wherein they are tackling the complaints of menopause difficult. Only those women for their typical symptoms need to be treated. And that is when we started to have more and more derivatives which were closer to estrogens. So they were like cousin brothers of estrogens with no vices, because we saw the conventional estrogens were giving breast disease or they were giving uterine body disease. So now they said, why not create certain molecules which will have a tissue specific action? So on the brain, it would act like an estrogen. So her hot flashes would go down, her mood swings would be better. On the body, it would help in keeping her breasts more full. It would help in redistributing her fat. It would take down all her urogenital symptoms. Why? By acting on the uterine lining like a progesterone. So there's no growth here, but it lubricates the vagina. So the sexual act, the sexual desire, the urinary tract infections, the exacerbation of prolapse and stress incontinence, all kind of comes under control with certain perineal exercises. So there were certain drugs like this that evolved, and definitely we have so many patients being treated with the same, but of course under medical supervision. So short of the long, what should you be doing? If you are suffering from any of these complaints, you first need to get a full body checkup done. Why? Because around the perimenopause, you may have a deficiency of certain maybe hemoglobin because you've had excessive bleeding, or if you have a family history of diabetes, you need to look at your sugars, not only a fasting and post meal, but an HbA1c, which is going to be telling you how your sugars have been for the last 3 months, your thyroid profile, your blood pressure. You need to do a lipid profile. You also need to check a sonography of the entire abdomen and pelvis, because whenever you take any drugs, they're going to be metabolized by the liver and the gallbladder, and you need to check your uterine lining and any adnexal issues if there are. Also to get a pap smear done once a year if you have your uterus intact, and also to get a bone density. So what is a bone density test? Very simple. No fasting, no pain, no injections. They just make you lie down on a scanner. It's done on an OPD basis in all major hospitals. They move the scanner on your body, and in 15 minutes we get to know the bone density. And depending on the severity of your bone loss, we can correct it with the help of tablets, exercise, lifestyle modulation, and certain hormonal tablets. Now again, I come back to telling you that every woman's treatment needs to be tailored. Why? Because each woman will have a different presentation. Somebody will come with hot flashes, somebody may come with abnormal bleeding. Always remember, whenever any woman has any abnormal bleeding in the menopause, she must study her uterine lining. It has to be treated with the highest degree of suspicion. Go to your doctor wherever you are and get a hysteroscopy done. Look into the cavity to see whether there is anything growing over here, and subject it to a histopathological examination and get a report clear that there is no problem there, and then you can safely take your medications. These medications need to be taken for about a year or so, and suppose you need it further, you need an annual evaluation. So all the tests that I told you need to be tested annually. So once we start women on certain tablets, what do we tell them? That first thing important for you is to see that you take the tablets for a month, come back to us and let us see how your response is. So we score the symptoms according to her complaints. How are the hot flashes? How is the sexual activity? How are you feeling overall? How is your urinary complaint? And accordingly, we see whether she's doing well or not. Adjuvant treatments along with this, of course, are calcium supplementation. So we do know all women after the menopause require 1 gram of calcium. So please take whatever brand of calcium you're taking, of course ruling out that you don't have any other issues with any calculi anywhere in the body, but you need 1 gram of calcium regularly. You need exercise. You need to be smart and you need to exercise. So at least 1 hour of flat surface walking. I always advise all my patients to take at least 10,000 steps a day. As far as possible, stay away from sugar. We do know the ill effects of white sugar. I know women at this age like to go for kitties and they like to go for celebrations, but as far as possible, if you can cut down the desserts and make your dessert platter more of a fruit platter, I think it would be definitely beneficial for you. And also to take proper sleep. At least 8 hours of sleep are very important, because if you don't sleep well, there's going to be cortisol release, which gives rise to water retention and weight gain. Exercises that you want to choose can be tailored depending on how you are, or how sedentary you are, or what your physical ailments are. Somebody with a back issue may not be able to do yoga, so maybe she could do aqua aerobics. Somebody who could be sitting on a chair with some issues or knee issues, we tell them anti-gravity exercises where they can move their legs, they can move their toes, they can move their hands in whatever way possible, or try to roll their hands, do neck exercises, facial exercises, any which way to keep themselves active. Women who can involve themselves in Pilates should do it. I do it with a very popular friend of mine who is a Pilates expert, Yasmin Karachiwala. So wherever, whatever, there are so many videos on YouTube today. I think this generation is really gifted with so much accessible to them. So you choose whatever exercise you want, but you must keep yourself healthy. As far as possible, stay away from smoking, from of course, substance and alcohol, let it be social drinking, because you do know the ill effects of all these issues. So, slowly and steadily, as you take this treatment, once you phase out of your acute symptoms, you must remember that you need to take your calcium and you need to do your annual checkups regularly in order to see that you lead a healthy life in the menopause. Now, it's very important for us to understand that the life expectancy of women today has increased. 30 years ago, the life expectancy of women was not like what it is today. Today, women are leading 1.5 or 1/3 of their lives in the menopause. So, we need to see as clinicians how we can make this period not the autumn but the spring of life for them. And that is precisely why I'm here to explain to you that we are all here to take care of you in the menopause. It's not so difficult, but you need to come out, you need to express, you need to address your issues, and we will definitely tailor your treatment for you accordingly. So, menopause, eventually, we want to make it the spring of life and not the autumn. Thank you, and for any further questions, we are always available here.